Hello, everyone, and welcome to our session entitled Understanding the Medical School Application Process. For today, we have Dr. Neha Vapiwala, who is a recognized and well-versed leader, mentor, and advocate. She is a professor and the vice chair of education in the Department of Radiation Oncology at UPenn. Moreover, she serves as the chair of the ACGME's Residency Review Committee for Radiation Oncology and was recently elected to the board of directors of the American Society of Radiation Oncology. Let us welcome Dr. Vapiwala.
Hi, thank you, everyone. Can you hear me okay? Thumbs up. Okay, wonderful. I am so happy to be here and really honored to be able to speak to all of you today. And I want to thank the organizers in particular for allowing me to speak to all of you. And I hope that over the course of the next hour together, that we'll be able to not only answer some of the questions that you may have that you've been wondering about, but also perhaps reinforce some of the messages and some of the lessons that you've already learned from others. So I'm going to go ahead and share my screen now. But again, if there's any issues with hearing me, hopefully someone will let me know via the chat. So I'm going to go ahead and share my screen. So what I thought we could do today is, and let me just double check the chat that, excellent. You can hear and see. Wonderful. You never want to assume, even though we've all gotten quite accustomed to Zoom, it's always good to have confirmation. So again, I want today to hopefully be an overview. I realize there will be things that perhaps are not addressed, but again, this is the beginning of what I hope is a conversation and a dialogue. So again, thank you for this opportunity to speak to you all today. So let's start with a very, what may seem like basic question. How do students know that they even want to pursue a career in medicine? Well, a lot of times, and for a lot of you, it might be because you've had health-related work experience, whether it's volunteering in a hospital when you were in high school, or perhaps working on some hospital-related or doctor mentored project that you may have sought out during your years, either in high school or in college. For a lot of you, it's going to be really something that's introduced in the form of science coursework, whether it's your high school biology or some inspiring science teacher that you had that really kind of sparked your interest and made you think, well, maybe I could see myself really pursuing a career in healthcare. For others, the intellectual challenge of medicine, and this, of course, none of these are mutually exclusive. They can all sort of tie together, but just the idea of always being challenged at work and really feeling inspired by all of the opportunities to improve healthcare and all of the research that's needed to improve our delivery of care to patients can be really stimulating and fulfilling. Family influence may play a role, and certainly it could be in the form of, inspiring and directly leading to this interest, as well as the family support that is needed to consider pursuing a career in medicine. And, this might tie into the fact that you may have physicians in the family, so that's part of family influence, but it may well be your own pediatrician or another physician whom you encountered in your life who inspires you and who motivates you and gets you thinking about this career. Unfortunately, for many of our applicants who consider a career in medicine, it's due to personal experience, usually a loved one or perhaps their own bout with a medical condition and an encounter with other doctors and providers that led to this and inspired this interest in a career. And then, there's always, of course, the role that our health professional advisors play at the undergraduate level in helping you think through what this could involve. Now, I named a whole lot of potential ways in which you might be inspired to pursue a career in medicine. But if you're curious, of those who do apply, how soon do they know? Because I know when I was applying way back when, there was always this feeling of, wow, did some of my colleagues have they known since birth that they wanted to be a doctor? Because it certainly didn't come to me until a little bit later in college. But the good news is, it is rare, relatively speaking, that folks who commit to medicine and actually apply to medical school have known before high school. And the majority of folks, it's either during high school or during college, most often, with a relatively smaller percentage who reconsider this opportunity of a career in medicine after completing their college degree. So as you can see here, the vast majority of folks will sort of make this decision during the high schools and college years. And from my understanding of the audience, I think that's who's with us today. So with that in mind, and knowing that that's, I believe, the audience I'm speaking to today, I thought the first step is try to pick a conducive environment that's going to support this interest for a future career in medicine. So for those of you who are in high school, who are thinking about where to consider going for your undergraduate training, as you review the schools that you're thinking about, one of the many aspects that you might look at are, of course, their placement track record for those that are pre-med majors or who have declared themselves pre-med. What's the presence of a pre-med interest group on their campus? How many of their students tend to apply to medical school, and where do they end up going? How many of them are admitted? So, these are just some obvious things to think about. And then think about the larger institution that houses this college or university. So sometimes, the undergraduate campus might have a certain focus and might be in a certain part of town, but is there an affiliated medical school? Is there an affiliated set of teaching hospitals? What's the research infrastructure there? What is the breadth and depth of their pre-health advisory program? What's the access to community service, whether it's rural, urban, or somewhere in between? And what kind of organizations exist both on campus as well as, the opportunities that you might have as part of the non-school community to give back? I'm here in Philadelphia, and I can tell you, many of our students, high school, undergraduate, and medical school students get involved in a plethora of community organizations, politically, legally, as well as medically oriented organizations. What are the seminars and lectures and opportunities for healthcare related topics, whether it's the insurance, business related side, to the actual care delivery, to the hardcore basic science research that's happening? All of the above might be important in creating that institutional environment that promotes your opportunities and your interest for a career in medicine. And then, of course, the location of the school you're considering, the class size, and how you'll fit in, along with all of those other aspects of your decision making when choosing an undergraduate school. For those of you who are already, and then of course, this is a very brief summary here, but ultimately the most important factor in any selection, in any point of your educational academic journey, is choosing the best fit. And fit is, of course, very differently defined, and it can be subjective, but it's that sense you get when you're on campus. It's that feeling you get when you talk to people who go there or who have gone there. And that sense of inclusiveness and acceptance and community that ultimately will matter, but just some guidelines to think about as far as the actual data and opportunities is what I'm listing here. So once you're actually there and you've found your college environment, if you haven't already, you want to, of course, get to know the academic advisor in the pre-health counseling office. And, this is not just a one-way thing, right, where they get to know you, but you'll want to know more about them and make sure that they understand where you're coming from, what you perceive to be, your strengths, but also perhaps areas that you're working on, what we call opportunities for self-improvement. Make sure that you also understand what areas they have specialized in, and maybe they're really good at advising you on which medical school to go to, but perhaps they're not the most keyed in on faculty to work with or networking opportunities for you to get really great summer internship, for example, between your junior and senior year. So again, getting to know them, making sure they get to know you, and then supplementing your academic advisor as needed is a great first step. And certainly as you go through your college years, I think one of the things that can often happen is just life and different aspects of your life that may impact how you're doing in school, and that may add to academic stress, whether it's the actual coursework or the class you're taking or something going on in your personal life. Whatever it is, if you start to experience that academic stress while you're in school, try to get the help. It can be a runaway train, and what you don't want to do is have perhaps one difficult semester or one bad semester turn into two. We often see applications where there's a dip in the GPA, there's a dip in the course load and the coursework and the performance. But what we look for is not that you had, this hardship and, oh my gosh, this isn't going to work, but rather what you did to get yourself back up, and what you did to kind of make up for that dip, and how you persevered. And so getting that help and getting it early and recognizing that it's okay to need help is a key step. And part of that is planning your schedule, planning your coursework, making sure you don't overload yourself at times of particular stressor when you know that family or personal obligations are going to be particularly difficult. And revise. Don't be afraid to have a game plan for freshmen through senior year, but then pivot if needed, and have that flexibility to say, you know what, I can't take physics right now. I'm going to have to delay it, and here's why, and I'm going to plan accordingly. So take your time to fulfill those requirements and try to glean from them what you can. The most magical thing about undergraduate years, about college, is that it's such an incredible time to not just focus on what you might want to do and need to do for that next step towards medical school, but also to learn and explore different classes, different areas, different disciplines that you wouldn't otherwise. And even if that's part of your requirements to get all your academic credits, that you have non-science exposures, or if you are a non-science major, trying things that you wouldn't otherwise. Just, I think having this time to fulfill the requirements, but also enjoying them along the way and trying to absorb what you're learning is something that I think every college student in hindsight might look back and say, I wish I did that even more, and enjoyed the time I had. So try to do it if you aren't already. Now, I mentioned before the academic advisor, and usually that's somebody in the pre-health advising, but you also want to seek out faculty and near peer mentors, right? Folks who are a year above you, maybe even a year below you, but have had certain experiences or certain, involvement that you're particularly interested in. Find those people, talk to them, learn from them. And this is where having your undergraduate training take place on a larger campus or as part of an institution that may have an affiliated hospital, that's where you can volunteer and shadow these faculty and get to know them and learn from what they have experienced. Even just an afternoon spent with someone whom you might not see again, but can be incredibly enlightening as to what your own journey might be. So part of that is availing yourself of the resources available. What are the research experiences? And you might learn about them through these faculty, through the near peer mentors, or it might just be a book. It might just be a compilation that someone's keeping somewhere in the university academic advising office. What are the summer program opportunities? What are the scholarships out there? So those are all the things that, obviously many of you may already be doing, but you just want to be mindful of. And at the end of the day, how do students prepare to apply? Well, their goals are really pretty basic. One is try to achieve academic excellence wherever you can. And that comes in a variety of forms. Overall, grade point average is, of course, the obvious one, but it might not be only at the school you're at. You might do summer courses somewhere else. You might actually transfer to a different school. So whatever school you go to, whatever your majors or minors are, doing the best you can. If you have a bad semester, trying to pick yourself up by the bootstraps and really, analyze why that is and manage those stressors and those issues, get the help you need to climb back up. And class load and the difficulty of classes, we do look at that. Academic excellence isn't just about looking at a GPA number, but what were you doing during that time? What were your other obligations and commitments? MCAT examination, preparation, and practice are also, of course, going to be a part of how medical students applying into medical school prepare. And then for those of you who did find medicine or decide on medicine later, completing that post-baccalaureate to either have those requirements met or just refresh and strengthen your academic skills after having been out of school are just some of the ways in which you can achieve this idea of academic excellence. And then the other main counterpart to this is engaging in extracurricular activities. So really what this is saying is, yes, do great in school, be a good student, be a solid student, challenge yourself, but also have a life outside of school, also have a purpose and a contribution to the world around you that comes in many different forms. It can be volunteer work, which led you perhaps to medicine in the first place. It can be laboratory research. It can be organizations and leadership within those organizations. But honestly, it can also be psychosocial research. It can be work that you've done that isn't directly in healthcare, but is for advocating for the folks that are unable to advocate for themselves, legal advocacy, for example, or tutoring of students that are at risk in your community. Any of these ways in which you volunteer ultimately does tie into giving back and to engagement. So that's really the crux of what we say. So switching gears a little bit to who actually is applying. What are the numbers here? These are data that are pre-COVID, and you can see here that there's been generally an increase in enrollment in medical schools over time. And what you see here is in red who's applying, and then here the actual matriculants. And overall, we try to track also data of who's underrepresented in medicine and how do they represent the pool. So this is the definition from the AAMC that many of you may be familiar with, and it's based on the US Census, and currently is comprised of individuals who identify as Black, as Hispanic or Latino, Latinx, American Indian or Indigenous, Native American, and of course those who are Eskimo and Inuit as well. So all of those groups are currently considered to be underrepresented in medicine, and about 1 in 5 of our applicant pool thankfully is from one of those groups, but again, far from representing what we need them to, because we are all seeking a physician workforce that truly reflects the patients that we serve, the population we serve. So something that we are keeping track of. And you can see here what the typical average GPAs, both overall and science, as well as MCAT scores are. What I want to mention, and what's not shown here, is the impact of COVID. And many of you may be familiar with the Fauci effect, as it's being called. And the idea here is that this inspiration to go into healthcare for myriad reasons that already existed, but perhaps were accelerated or reignited by the role that physicians and healthcare providers in general have played in managing the pandemic. The frontline workers, our nurses, our therapists, all critical to this. And all of these healthcare professions have seen an increase as a result of recognizing that it is an incredibly noble profession and an incredibly important part of how we're surviving this pandemic is through the sacrifices of our first line workers. And so, That is a key part of why we've seen roughly a 15 to 20% increase in 2020. And so far for 2021 looks to be on track for a similarly high number of applicants, but also applications. So while the number of individual bodies entering the medical school application pool has gone up, so have the number of places that each of them are applying to. So that's what I mean by the number of applications. Keep in mind, though, that over this time, there's also been an increase in the number of medical schools that have opened up, some of which are sort of for-profit medical schools, so they're not necessarily affiliated with not-for-profit universities, but they are accredited medical schools that are offering training in the US. And so, there is this push to try to keep up with this increased interest on the part of the students by having more positions available at medical schools in the country. In terms of our checklist that I would recommend as you're kind of considering putting yourself in that applicant pool, do you want to do early decision or regular admission? And that's something that your pre-health advisor can certainly guide you on, the pros and cons of picking one school where you might throw your hat in for early decision, and if there are any downsides to it versus giving it a try, but recognizing that if you do get in, that is a commitment. Getting organized, reading directions, I cannot emphasize this enough, really checking on all of the timelines, all of the deadlines, so that you give yourself, but also others, right? Those that have to provide your transcripts, those that are going to be providing letters of recommendation. You want to give people ample time to not just get the job done, but to do it well. So again, paying attention to procedures and deadlines, it's like a broken record, but it's important and critical, and amazing how easily you might miss the deadline if you don't sort of have all of this in an organized way with many reminders. Keeping it simple is something I also advise as you go through your applications process. I think eliminating schools from the list that you clearly don't see yourself at geographically or for other reasons. You just know, yes, I'd love to think about this school and might be nice to visit for an interview, but the reality is I don't see myself going there. Don't overburden yourself with more applications just to have more, and really try to be thoughtful and work with your mentors and advisors to create and curate a list that makes good sense for you, that's big enough of a list, but not overwhelming. And establish an overall game plan and narrative for your application. What are you about? Are you someone who came straight out of college and just has been thinking about medical school since day one? Are you an applicant who has gone and worked in other industries and had an entire other life, if you will, after college before coming back to medical school? All of these are okay, but what's your narrative? What brings you to the table now? What has you throwing your name into the hat, for this applicant pool? And really make sure that your application will convey that. But sometimes before you start to sit down and write all this stuff, really think about what your overall narrative is and what the game plan is. And mind you, as you're doing all of this, you got to stay focused on your day job, whether your day job is being in college and being a student and doing well, or if you're already out of school, completing your post-baccalaureate training, or holding down literally a full-time day job, whatever it is, doing that as well and meeting all of your obligations while you focus on what can be a somewhat consuming process. From our perspective on the admissions side, I want you to know that we really are wholly committed to holistic review. And obviously I can speak for my own school, but I like to believe that all of my colleagues across the country at US medical schools share this perspective, which is that we are looking to always think about the entire individual, to not be so rigid as to miss key strengths that you may have, that make you an individual, but that also assess your capabilities, not just what you've accomplished, but what your potential is down the road. And that means looking at the academics, looking at your activities, but also your personal attributes, right? How might you contribute value as a medical student on our campus, but also as a future physician and part of our community? And this is just to illustrate that it's such a multifaceted thing. And I don't have percentages or weights or formulas assigned to this. I'm looking at the diversity and the breadth of what you've experienced in your life, a lot of which is not in your control. If you've had very few hardships in your life, that's not your fault either, but what have you done with opportunities that you were given, with the privileges you were or were not born into or had access to? What have you done with those resources? And what are the different ways in which you express your resilience, your maturity, your values, your commitment to medicine? All of this plays a role. And so some of the components, just getting a little bit deeper now into how we look at this: academics, the activities, the personal statement, letters of recommendation, and the interview. I'll say a little bit about each. The academics, there's the recommended coursework, there's the lab work, there's the things you got to have, but at the end of the day, what else did you pursue with your college education? What else did you do with your time? It all gets back to that. So again, have this checklist, meet your requirements. But what we really want to know is, did you also go beyond what was needed for your major, for your minor, for your pre-med checklist? And part of that is really thinking about the question that I think historically people have worried about and wondered, oh my gosh, that checklist is overwhelming. Does this mean that non-science undergraduate majors need not apply? Of course not. Not only do non-science majors play a very critical role in that applicant pool, but actually a lot of people who end up getting into medical school, and I'll speak for Penn, more than the majority, for more than 5-6 years, the majority has been non-science majors who we actually take. And so just rest assured, for those of you out there who are not necessarily science majors, that, nearly half majored in something other than the typical biological sciences. You should also know that, performance on the MCAT does not seem to matter. It's all about preparation in the end. And so whether you have the science or non-science major, as long as you have the adequate background and you've done the prereqs, you usually can score similarly well. And that's what I mean by taking the recommended courses. And I think at the end of the day, what we're looking for is, did you demonstrate the ability to handle the rigors of science and your selected major if you are a non-science major? If you're somebody who, majored in Latin studies, were you able to take those advanced Latin courses, do well in those? And, if you did take any science along the way, how did that go? And were you able to balance that course load? It shows the potential, once again, and your aptitude for adapting to whatever medical school throws your way. And again, this is just to demonstrate, this is, of course, going to be different every year, but this just shows you some relatively recent data from 2018, 2019, in terms of the applicant pool and the distribution of the typical majors, as well as who actually matriculated in medical school. And again, while overall, biological sciences represent half, the other half, as you can see, were not your typical biological science majors. A brief word about the MCAT. I mentioned, obviously, that this is part of the academic piece, and what we're calling the new MCAT. It's not so new anymore. For those that are not familiar, here's a nice little handy table for your reference. I realize there's lots of sessions on the MCAT during this conference, and so I'm not going to belabor that. There are folks who can talk to you about it in detail, but suffice it to say that, one of the key aspects, again, is practice, practice, practice. And, really, if you need a prep course, if you can take a prep course, wonderful. But again, those practice exams, and while it seems like a super long time, and it is, really getting this sense of your time management is also super important to MCAT preparation. So that's all I'll say there. I do just want to wrap up the academic piece, give you these data Again, over that same time period that I showed you, the number of applicants and the number of matriculants to medical school, this just gives you a sense across the country of the national average GPA and MCAT scores of who's getting in. And so again, right around 2015 is when the new MCAT was introduced. And you can see here that each year of the new MCAT, there's been a slight increase in terms of performance, average performance on the MCAT, whereas GPA, not surprisingly, is pretty much steady because there's no reason why the MCAT should change what the typical GPA is for matriculants, and it hovers and has hovered around 3.7 for a very long time. So that's the academic piece. Now, let's talk again about activities. It's such a bland term, but it's not really about activities, right? It's about what inspires you. What are your different interests? Where have you spent a lot of your time that you choose to spend a lot of your time? Where have you been chosen for leadership positions, either by your peers or by your faculty mentors, because of your commitment to the cause? And how have you learned about yourself and your interest in medicine through these activities that you chose? Now, of the folks who apply to medical school across the country, over 3/4 have medical, clinical, community service, or volunteer clinical experience. I'm sure many of you on this call, on this talk, do as well. About 3/4 have done laboratory research or have publications that sort of speak to that experience. But the other important thing to note is that many of you have non-medical, non-clinical, truly community-based volunteer activities that might involve anything from, obviously musical talents and commitment to sports, but also activities that are truly community volunteer-based that are not linked to any sort of medical experience. And so again, any of these, there's no one that's valued more than the other. But again, what's your narrative? What's the story you're here to tell? How did you eventually use these opportunities to grow as a person, to help others, and to solidify your interest in medicine? A way of then articulating that, it's one thing to list activities, and we do ask that folks in the application process identify their 3 most meaningful activities, and you'll be asked to do that and to write some more about why those are the most meaningful to you. And it may not be because it's the most number of hours. It may be an activity where you actually didn't spend that much time, but it was one of your 3 most meaningful experiences and activities, and you can articulate why that is. But again, those activity sections in the application are limited. So that's where the personal statement and some secondary application questions are really trying to drill down deeper. They're trying to get a deeper dive into what makes you tick. What is your story? And we see all these activities you participated in. We see you were an athlete. We see you were a member of the orchestra. But what else? What else is going on behind the scenes that helps us to get to know you as a person and that sets you apart? That's where your opportunity to really elaborate comes through in the personal statement and in the application questions that are trying to delve into that. How do you contribute to the diversity of a school? It's not solely based on your racial and ethnic profile. It can be based on where you grew up, what kind of environment you grew up in. Were you first generation college student? What kind of diversity of experiences have you dealt with? And adversity, did you have to, take a bus 3 hours each way to a part-time job to help save up enough money for college tuition? This idea of distance traveled is in quotes because it's not about the geographic distance, but it's more so about what are some of the barriers that you might have had along the way to get you to this point of medical school applications, and how did you handle those barriers and how did you overcome them? Have you overcome them? Are you still struggling with them? And so all of these aspects, maybe personal illness, again, that you feel comfortable sharing, that you want the committee to know about you, this is your opportunity to do it. And, there are ways to do it that are not overly long. Don't be wordy when you don't have to be. You don't have to repeat things in that personal statement or secondary application that don't need to be repeated. Certainly for emphasis, is fine, but just be mindful that humans are reading this and you want to encourage them to read it carefully. You also don't want it to be so generic that the first couple of sentences, they're sort of hearing just a regurgitation of the rest of your application, or something that just says, that, okay, you're interested in medicine because you want to help people. As important and fundamental as that is for all of us, you don't want it to sound trite or cliched. So just thinking about that, and proofread. Of course, have others read it, give you feedback, but also, of course, the typographical errors is a big, an easy thing to fix, and you wouldn't want to submit with that because it shows perhaps not an attention to detail and a carelessness that some committee members might hold against you. And anything you write down in this personal statement or in your secondary application, be prepared to discuss at your interview, if and when you're invited, because you want to be able to convey a lot of this in person, what you've previously had to convey in writing. So if you write something compelling enough, be prepared to discuss it, know and remember what you put in there so that you're not caught off guard. In terms of letters of recommendation, this is something where, again, I'm sure there's, I realize entire sessions devoted to this, but the obvious place to start is, of course, meeting with your pre-health advisors and any of your mentors, academic mentors, your advising mentors, your near peer support for advice, but ultimately develop these relationships early on, so that when the time comes for letters of recommendation, you have people who can speak to who you are, who know what you've done, and who, more importantly, can speak to what you're capable of in the future. And being aware of, again, as I mentioned before, timelines and requirements, give your letter writers ample opportunity to get a nicely written letter done on your behalf, and updating them, of course, on their CV. And it is appropriate for different letter writers to get certain, obviously you're not going to micromanage it. And many of these folks are people who might, feel intimidating, or that you would never sort of want to give direction to, and you don't want to nag or anything. But it is reasonable to say, I was really hoping that you could speak about my contributions to the class and to the honors thesis that I did, or I was really hoping you could speak to the volunteer work I did outside of your classroom that you were my faculty mentor for. So give them some guidance on what you're envisioning, so that each letter writer might have some unique aspect that they're covering. In the end, it's not in your control what they choose to write, but giving that guidance and how you do it is something your pre-health advisor can certainly assist with. Just a brief word on interviews. This is a talk unto itself that we could go on for hours, but obviously, whether it's virtual or in person, be prepared, be on time, be informed about the school that you're interviewing with, and really try to be ready to ask thoughtful questions. And this is where I think having some that you've already, of course, prepped is always helpful, but also there might be something in the midst of your interview itself that comes up that's organic and that's natural, and that feels like an appropriate question to ask when the opportunity presents itself during the interview to do so. And of course, the types of interviews can vary. There can be individual, there can be small group, it could be with faculty and existing medical students. And of course, the mini multiple interview format, which some of you may be familiar with, that's more of a sort of regimented approach, but really trying to measure competencies of your communication skills and your insight, your judgment, and your ability to be a good team player. So, know what you're getting into and what kind of interviews that school is going to have, and all the preparation and mock interview opportunities you may have on campus or with other friends who are applying, or with near peer mentors who can help you, is always, I think, advisable, just so you have that opportunity to sort of practice out loud and hear yourself and get that feedback. So, I think some additional things that I would just say, and sorry, I can't actually see the top of my screen, so can't tell what it says on top, but I think, one thing that I definitely want to convey are some areas where you don't want to fall into the trap. And it may not be a conscious thing. You're going to read these bullet points and say, yeah, of course, I would never do that. But it may end up happening inadvertently, unconsciously. And so you just want to be mindful that as you're going through your application and you're listing your activities and you're listing the hours and how many hours you did this and how many hours you did that and what you were involved in, try not to overinflate or over pad your application. Most of us in admissions committees can see through that, and you would never want to misrepresent your contributions to a particular activity, a particular class, a particular event. Also, over the course of all your correspondence, whether it's through email with the admissions staff or during your interview day or after your interview day or with other students who go to that school, try not to ask the most basic of questions that are already on the website. When is the deadline for XYZ, for example? You may not mean to, have asked something that's on there. And if it happens, it's not the end of the world. But to the extent that you might have other resources to check before you spend someone's time asking a basic question, try to get the answer on your own. That way, the questions you do ask can be reserved for the things that you really want to contact the school for. Submitting vague recommendations. What I mean by this is, sometimes we get letters that are passed along to us that are not necessarily part of the letters of recommendation that we were expecting, but maybe just some additional support letters that get sent to us or that get added on to the application. You just want to be careful if you have these add-on letters. It's really best that we stick to letter writers, those who know you, who taught you, because sometimes it can work against you to just have these additional letters that aren't adding much and might actually look bad because they're only a paragraph long, for example, from somebody that you worked with for one volunteer afternoon. This is a big one. So do not, to the extent that it's possible, be careless about social media because your internet presence does matter. And I would advise, exercising due diligence with anything that you're sharing with the public, whether it's pictures or posts or tweets, whatever it may be, to the extent that you can't control what others do, who you might be linked with. This is about your own social media presence. And, there have been times where certainly pictures of individuals with, what could be construed as potentially illegal behavior, or potentially offensive behavior. And certainly to the extent that when you're a physician down the road, patients can see this. It's just good practice to get into even now at this very young stage of your careers, because it's only going to be, I think, more and more critical as you get further along in your medical training. Disrespecting staff members in whatever way that you think could be construed as disrespect, whether it's through a phone call or through a terse email or through ignoring their emails to you, requesting some piece of information that they need, whatever it is, that can always come back to haunt you. And, look, in general, you're going into medicine, you are truly nice people who care about others. Make sure your actions reflect that. Another no-no is for those who try too hard to curry favor. So, what form does this look like? Well, it might be sort of throwing around names of people you may know. Outside of, it's certainly appropriate to mention connections or alum, but, if you're kind of name dropping all the time, or if you're trying to perhaps have some other person on your behalf curry favor with admissions, just be very careful about what it is that they're doing or what they're asking for, because it could reflect poorly on you. Obvious one, don't miss deadlines. Please read instructions. So I just want to, in our final minutes, switch gears a little bit and tell you about the story of somebody very inspiring. Dr. Lafall Jr. Was actually, as you go through this whole application process, I just want you to think about the stories of many, many folks before you. And again, this is an example of where forming connections, finding faculty mentors, advisors can lead to learning about these stories. So he was the first African-American physician to serve as national president of American Cancer Society. I'm an oncologist, so this is, something that the American Cancer Society I'm very involved in. And he, in particular, he took his opportunity and his platform to focus attention on the increasing incidence and mortality of cancer, in particular among Black Americans, and the disparate outcomes that we see in that population. He also has a bunch of other accolades, being the first African-American president of many other national organizations. But the point here is that he attributes three things to his decision to pursue medicine, very similar to some of the experiences I told you before. His parents and the influence they had in his life, not being physicians themselves, but teaching him the love of learning and education in general. Having a role model through a family friend who happened to be the only Black physician in his community. And then an experience, as he says, nursing an injured bird. So, his first patient being of the avian variety, but the idea nonetheless that caring for and helping an injured living being to help them heal can be an incredibly inspiring experience. And the reason I'm bringing up his story is that he was actually rejected from medical school initially because of a low score on his MCAT of all things. But the college president of where he went to college at Florida A&M University traveled to this medical school to lobby for him, to lobby in person about why he very much deserved to go to medical school. And lo and behold, he did go into medical school, and he graduated first in his class at Howard University. And so again, you saw and heard all of his wonderful accomplishments. That's why I showed those to you first. But I want you to know that everyone has been through their share of rejection and hardship. And as you go through this application process, if there's one thing I can convey, it's that, okay, maybe you're not going to necessarily have your college president travel and lobby, but trying and trying again can absolutely lead to success, and not giving up is the ultimate goal. And, I think that one of the most important and inspirational quotes for me, and I'm at University of Pennsylvania, so we have quite a history with Sir William Osler, but one of his, I think, more inspiring quotes is that medicine exercises your heart and your head, and that it's an art, not a trade. It's a calling, not a business, and a calling in which your heart will be exercised equally with your head. And I could not think of a more eloquent way to state that. And so if you remember anything from all of this, talk that I gave, and most of this, I imagine many of you already knew. So I'm sorry if I didn't add too much to your knowledge base, but I would say, work hard, but work smart, right? And don't think that because you've had a bad semester, or because you've had a non-science major and had to go back and complete some coursework, or because you had a low MCAT the first time, that you can't come back and learn from those mistakes, or learn from those less than stellar performances and come back even stronger. Find your team of supporters and honest advice givers, right? The advisor who's going to help you curate a list of schools to apply to that's both outside your reach, but as well as within your reach, and is able to give you advice on everything from your personal statement to your overall expectations and goals. And be thoughtful about the choices you're making and what you're sharing in your application, but also, where are you headed, and what is your story? You are creating your story as you do this, as you go through the application process. It's not just about where you've been, but what your application says about you moving forward. But ultimately, and I say this to all of you, no matter where you are in your training, find out who you are. High school, college, incredible, rare opportunity to do just that, to grow, to learn, to follow your passions. They will never steer you wrong. And I just want to end with saying, medicine, despite all of the craziness that's happening around us, it remains one of the most rewarding careers I think anyone can possibly ever fathom. And, there's very sort of, obvious reasons why, but perhaps the hardest to articulate is the fact that coming into work every day and feeling like you make a difference, it really can't be put into a bullet point. It really can't be conveyed in anything other than letting you all know that I think that it is one of the most fulfilling ways in which to exercise your mind and your heart, as you just heard from that brilliant quote by Sir Osler. Aside from that, there is job security, there is financial remuneration, there is increasing attention to student debt so that you can be freed of some of those financial barriers, knowing that once you're ultimately in the field, that the profession will take good care of you, and that it is truly intellectually and personally gratifying all along the way. So with that, I'll just say thank you and wish you all the best of luck, and that medical school can be in your future. And I'm happy to take any and all questions, and I'll stop the share at this point so I can see you all again. And thank you again for your attention, and to the organizers for letting me share some of these thoughts with you today.
Thank you so much, Dr. Vapiwala. That was such a wonderful presentation, and thank you for all your insights. And we'll just get into the Q&A because we have a lot of questions lined up. For the first question, we have, what are some ways to stand out and differentiate yourself from the rest of the applicant pool?
Yes, that's an excellent question. So this is where sharing a bit about your personal story, to the extent that you are comfortable doing so, thinking back to a moment where your decision to medicine clicked, or admitting freely that it wasn't a single moment and that it took X number of years or experiences, to help you get to this point of knowing that you want to pursue a career in medicine. Sharing that in your personal statement or in your secondary applications in a succinct but personal way can certainly help you stand out. Sharing what you can about some of your activities and your experiences, so they don't just look like lines on a CV. Okay, yes, I spent 5,000 hours, in the lab doing this, but what did you glean from that? What did you take away? When was a time where you thought this research is not going to end up leading to anything successful, and you almost quit? And sharing that vulnerability is another way to truly help yourself and help your application stand out. Making sure that you have, while you still can, participated and engaged in activities that perhaps are not necessarily pre-med CV related, but are something you did for yourself, or that you did for your classmates, or that you did for the city or the town that you live in, and highlighting that can help you stand out as well. Again, I mentioned earlier, I was referencing actually a student that specifically articulated that he had to travel 3 hours each way because he didn't have a car, grew up with a single parent, and had to take the bus to get to his work, study, job, and back. And it's because of that commute that he was not able to have more activities. He had actually very few, but he was able to explain why that was. And I think, again, explaining and owning what may appear to be shortcomings on your application, and doing so in an honest way, I think that's a great way to help yourself stand out, because it gets the committee a chance to get to know you and to understand where you're coming from, rather than filling in the gaps and making up the story ourselves.
Okay, thank you so much. And for the next question, are there some application red flags or things to avoid mentioning or discussing?
Yeah, so I think there aren't necessarily red flags within the application to avoid, as I mentioned, what not to do, which is outside of that. If there are areas of your application that clearly represent, as I mentioned, it was a really bad freshman year. I had a hard time adjusting to college. My GPA was really low. It's okay to own that. It's okay to reference it, but it's not a red flag you can hide or do anything about. So again, I think, making sure that you address that somewhere in the application is important. I would say the one thing as I mentioned, also on my don't do this list, is the overinflation, putting a number of hours that can't possibly be accurate, or picking for your 3 most meaningful experiences something that perhaps really doesn't make sense compared to the rest of your narrative, the rest of your application. Some of those things, I don't want to use the term red flag, but some of those could certainly raise questions or concerns about why did you choose these meaningful experiences and ignore this other global health experience that clearly you spent a lot of time on, or how is it even feasible that you spent this many thousand hours doing this activity when it only spanned a month? Things like that. Just make sure there aren't obvious discrepancies.
Okay, thank you so much. And unfortunately, we are pressed for time, but Dr. Vapiwala, if you could provide us an email address where students could reach out to in the chat. Thank you so much.
Absolutely. Will do. Thank you so much, everyone, for having. Really appreciate it. Best of luck to you.